Thanks for joining us today. It's Cat Health Month, so we're really excited to be here at West Village Vet with Dr. Hildenbrans talking about cats, all about cat health. I'm Liz Raganella. I'm the Senior Program Manager at PAWS. I work with the volunteers and the clients on setting up regular volunteer opportunities for cat care, dog walking. That's my main role, and I'll let Dr. Hildenbrans introduce herself and we'll go from there.
I'm Angela Hildenbrans. I've been a vet for almost 10 years now. I went to vet school in Colorado, graduated in 2013, and then I did an internship in Brooklyn. Worked in Brooklyn a couple years, and now I've been at West Village specifically, but we have the 4 hospitals, so we have 4 hospitals, DVMH. Been here about six plus years now. Happy to answer everybody's cat questions today.
I meant to say West Village Vet is one of our partners, so we work with them a lot. We send our clients pets here often for regular care, specialty care, and they've been an awesome partner. Dr. Hildenbrans, you are a fear-free certified vet. Can you tell me a little bit about what that means?
So fear-free is kind of just the idea of trying to make it as easy as possible on the pets and the owners and the staff. So when animals come in, if they're really stressed out, we try to decrease their fear, their anxiety, their stress. If anybody sees us like looking on the floor, it's because we have cats roaming around. Cats are on medication called gabapentin to help decrease their stress from coming in here. My tech Brianna was nice enough to bring her cats in today. And so yeah, just like we've gone through some additional training, we've gone through some programs to try to just help you learn about what signs to look out for if animals are stressed out, recognizing like fear scores in animals and doing what we can to kind of decrease that, whether it be modifying things for what works for that patient. Like sometimes we have very specific things that we do for very specific patients depending on what their their specific fears are, or just giving them medications to help it decrease their anxiety before they even come in here, so that they're not like getting higher thresholds as they're progressing through their visits.
Yeah, that makes sense. And to sort of piggyback off of that, sometimes we have clients with cats needing to get to a clinic that are super fearful of even getting into a carrier, and we sometimes have volunteers willing to work through that. But could you give some advice on somebody, maybe an older person or someone with mobility challenges, in terms of like actually wrangling a cat to get here to the vet?
I think one of the things that's different with cats and dogs is that dogs usually leave the house all the time. They go on walks with their owners, they go places. Most cats do not. They're used to just like their home is their little sanctuary and it's safe there. So when they see the carrier come out, they're like, I know this means I'm leaving and this is gonna not be fun. I usually tell people just make sure you take the carrier out well in advance. I bring my cat in, and when I go home, I just forget to put the carrier away for a while because just leave it out. And then she really likes to sleep in there. She finds it a comfortable space. So bring the carrier out, have it out for like days before your appointment. Sometimes they'll even be like sleeping in there, and then you can just snatch them. You can use like treats to kind of like lure them into the carrier. We do use medications. So I'll tell owners, like, if you're really having a hard time getting your cat into the carrier, we give them medications beforehand so that they can get in the carrier. And then once they're here, they have medications on board. Like this guy,
sweetie, he's like,
this guy's got medications on board, and he was very easy to get in his carrier today. Ready? So yeah, like medications, and talk about it with your vet personally, because they might have other recommendations, like specific. Also, like the types of carriers that have multiple ways of going in, like top down and from the front, are just easier on owners, because some cats won't like to go down to the top, some cats don't like to go to the top, go in. So having those carriers that have easier ways of like opening them up, like if you can take off the top, it's like it can almost be like there's the bottom half, maybe they'll just be sitting on it and then you put the top over it, but those are the more hard-sided like clamshell carriers. So
great, that's really helpful. What can you tell us a little bit about cat health, and what would be some of the main things you would tell someone, maybe a new cat owner, to keep in mind, most important things for cat health?
I think a lot of the time cats like to hide things. They're notorious at not telling you that they're sick until they're like really heckin' sick. And so just getting to know your cat, knowing what their normal is, because like I think a lot of the time too, again, the cats are in your house all the time, so you're not used to them having to go out. And so people are just like, cats sleep a lot. They just kind of like are these little hairy potatoes. So knowing what their normal is so that you know that if they're not acting like themselves, you can see that sign early on and you can bring them to your vet to kind of let them know. And I know it's so easy for people to think like, oh, my cat doesn't go outside, doesn't see other animals, like they're acting fine, do I really need to bring them to the vet? But I think having them get annual checkups, especially as they get older, is important because it can help us identify problems earlier. We can do screening blood work just to see what things are going on. Like, best case scenario, we do blood work, kidneys and liver are good. We have a good point of reference for the future if they ever do wind up getting sick in the future. I know a lot of times, I know we were talking earlier about vaccines and things too. Legally, they should be vaccinated against rabies. Even coming into going into seeing them on an annual basis for vaccines, that can help us just make sure we monitor trends over time. Like, are they losing weight? Are they too heavy? Do we have to talk about, development of arthritis, things like that. So just owners knowing their cats and helping us get to know them as well by bringing them in consistently over their lifetime.
Yeah, great. A question I sometimes get from clients is, my cat doesn't even, not only does he not leave the apartment, he barely even leaves this one corner. Do I really need to get all these vaccines if he's not interacting with any other pets, hardly any other people? Are vaccines, which vaccines are necessary, if any, for indoor cats, indoor-only cats?
Well, me personally, and everybody has their own thoughts. The core vaccines for us would be FVRCP, which stands for rhinovirus, calicia, and panleukopenia. Those are viruses that are in the upper respiratory tract and intestinal tract, and rabies, which is rabies. It's a potentially deadly disease that's transmitted by wild animals and stuff like that. So those are the core vaccines, FVRCP and rabies. There are also vaccines for feline leukemia, which is a virus. I talk to clients about the two main vaccines, and that rabies is technically required by law. So if you ever have somebody come into your home and your cat bites them for one reason or another, even though the chance of them getting rabies is very low, legally, you could get into a little bit of an issue there. So being up to date on rabies is important in that regard. And then for FVRCP, so yes, I agree, when they're in their home, they're probably not getting exposed to these things, and unless the owners are going out and seeing other cats and then coming into the home, because there is a potential they could bring stuff with them. I tell people, when you bring them to us, we get animals all the time. We get cats, we get dogs. You never know who's sitting next to you in the waiting room for one reason or another. Their risk would be that they could potentially be exposed to things when you bring them here. Doesn't mean we don't want you to bring them in to just kind of get them checked on annually, but it's an easy enough vaccine. Typically after they get their proper series, we do them every 3 years, and so just trying to keep their immunity kind of bolstered. So you talk to the owners about the pros and cons of why we do what we do, and then it's an informed decision amongst everybody what's best for that patient.
Great. Any tips, particularly for cats that might have been living on the street, coming into someone's home, a specialty care for that kind of situation?
Well, I would definitely make sure that if you're going to keep that cat, that you loop in your vet, bring them in for a vet exam, make sure everything is okay. You should definitely keep them separated if you have another cat in the household, because we don't know what's going on with that cat. We don't know if they can have infectious diseases that they could potentially give to your cat. So want to look out for things like parasites, rabies, probably won't have rabies, but exposure to rabies, things they could have fleas, they could have other skin issues, and so and leukemia and FIV. So those are two viruses that are transmitted either through, they can be commensal activities, if cats were grooming each other, one could pass one virus to another, or fighting. So usually seen that with FIV. So those are viruses that could be potentially transmitted to an owner's cat if they bring another cat in that's positive. So keep them separated. Obviously don't get yourself injured either. A lot of times people take animals off the street and you don't know what that animal's behavior is or personality. You definitely don't want to get bit if they don't have a vaccine history. So anything you do, you want to do it in a safe manner for you and for the cat or the pet. And then once you get them to the vet can give you a better idea of systemic and overall health, do an exam, give them any kind of medications they might need, any vaccines they might need. I think the most important thing is keeping them separated from your cat until you can get them to a vet, and your vet would probably have this discussion with you about testing to do and how long to keep them separated.
Great. Any tips on grooming? So brushing, Nail clipping and giving medication to cats. So our volunteers sometimes help us with these kind of tasks, but again, having in mind someone maybe mobility challenges with some of these more physical parts of pet care, make it a little bit easier.
Right. Well, I think as far as grooming goes, cats are very good about maintaining themselves. Typically, so anytime people are asking me about should I bathe my cat, I usually say no.
No, yeah.
Unless they love it. But cats are very good about grooming themselves. The things that we can see that they have some issues would be if you have a larger cat that might be a little bit overweight and they can't groom properly in reach areas. Longer haired cats can get matted, so that's where you might have to give them a hand in grooming. If that's not a specific case, you can try to see if the cat likes to be brushed. Some cats love it, some cats hate it. I just wouldn't push it if they don't like it. Other things like getting their nails trimmed regularly, that's something where if you can start it on early, that's the easier thing to do. It is a little bit more difficult because you have to kind of push on their paw to get their nail to come out and clip. So if you have people with mobility issues, it might not be the easiest thing to do. There are a lot of times where you can, I know it's hard if you already have a mobility issue, bring your cat to the vet, but sometimes you can get people to come to your house, there's groomers that can come and trim nails and stuff like that. Just monitoring to make sure that their nails aren't growing into their paw pads. But if you have a cat that's never had its nails trimmed, you can try it and see how it goes. And then depending on how they're responsive to it, lots of positive reinforcement, give them treats and churu. I love this stuff here. Give them churu to show them positive reinforcement for them getting their nails done. And if they're not really receptive to it, you can try to do slow and steady introductions, give them positive reinforcement with the nail trimmer and then with touching their foot. And it might take some time to build it up, but just trying to work on that over time. Medication is another thing entirely. It usually just depends on what the medication is. I always think the less hands-on you can be with a cat, the better, only because once they decide they don't like something, it's usually you don't have a whole lot of wiggle room, and if people are having mobility issues, to have to struggle with a cat is not fun. So try to say if you can give it in a very benign way, in food. Again, chew is a great way to go. Sometimes you can just cover it with something. We have things that pill pockets or a soft covering that you can cover things. If we have for gabapentin for these kitties here, you open it up and you sprinkle the powder into a food. You can work with your vet on if you're having trouble giving medication. Sometimes there are ways for us to give it in a different form. So sometimes I'll ask clients would you be better with a liquid or a pill? If we try one and it doesn't work, you can try the other. We can call it into a compounding pharmacy for some medications to flavor them, make them higher concentrations, so less dose. Some medications can go transdermal where you would rub it on the ear and it absorbs. So those are some ways to get around it. And then you've got the whole traditional pilling route, which is usually the hardest.
Yeah.
We kind of work with everybody to say what people usually know. I'll be like, hey, have you ever had to give medication to your cat? What's worked before? What hasn't? And then we can kind of go from there.
Great. That's really helpful.
We are looking at cats on the floor.
Yeah, we keep looking down.
We keep looking down, but there's just, some free roaming cats. Hi, guys.
They're all kind of chilling now.
Oh, yeah.
Hi. Yeah, I was going to say, maybe we want to
have some demos.
This is Lily? Yeah, Lily.
Yes, this is Lily. This is Brianna's Lily. She's a very good cat. She's 10 years. I thought she's only 9. She's 9. So yes, Lily has had some medications on her way in here, so that's why she is also very mellow, but she's also a very well-trained cat. Brianna raised her from a young age. And so usually if you had to do nail trims, you push on their paw to kind of get the nail to come out, and then there's a little, you can see the quick, which is the blood vessel and the nerve. So you really just have to cut off and take the little tip there. So you do a gentle little push, and you would just take that little tip off the edge. You never want to cut the pink because that's got the blood vessel and the nerve. Don't forget they have thumbs here. The thumbs are the ones that they can get overgrown a little bit easier because they're not really contacting the ground. Me personally, the way I do it with my cat is I do it at home alone. I sit with her in my lap. So I sit with if I'd be sitting with my lap like this, and I just kind of hold her foot out like this and trim that way. Mm-hmm. But some cats are easier, some cats are more difficult. Drugs always help.
Yeah, you seem pretty.
She's I like drugs.
She doesn't mind.
But yes, it helps to be more fear-free. And then if you're having any issues, you can always ask your vet for some tips. They might be able to help knowing how your cat is. Do you want to stay up here? You want to go on to FNOA? I don't know. With some meds on board, I don't want her to jump.
Yeah. Oh, she could jump.
Slip her feet.
There you go. Common concern or behavioral thing that comes up that I've heard is cats going to the bathroom outside of the litter box.
Mm-hmm.
Any thoughts on why that might happen? What to do about that?
Well, I guess there's peeing and there's pooping. There's a couple things going outside the litter box. So each one can have its own, unfortunately it's a frustrating problem, but it can be for a lot of different reasons. Because there are some medical conditions that can be underneath it, you always want to kind of, again, involve your vet. I guess we can do broad categories. So like defecating outside the litter box is a little less common. Usually they're peeing. They could have some like gastrointestinal issues. So it depends on like, is it diarrhea? Is it a foreign stool? Is it like a one-off, or is it happening all the time? Is it completely away from the litter box, or is it like right near the litter box? So sometimes cats will, I try to get there, I know I'm supposed to be there, and I just couldn't make it. We all know that feeling.
Yeah. Yeah.
Cats don't have the dexterity to open the bathroom door. Or sometimes, like I've even seen in long-haired cats, sometimes it just gets caught in their little tail feathers, and so you have to kind of discern, like, is it persistent? Where is it happening? You know, have you changed their diet? Things like that. And then as far as the urination goes, like, again, it depends on, like, are they a boy or a girl? Do we potentially have to worry about a urinary tract infection? Or in boys, we worry more about, like, a lower urinary tract, like cystitis. If I have a boy cat that's urinating outside the litter box, I would definitely say get him to the vet sooner rather than later, because they can develop a urinary blockage. And so that's kind of concerning. And so that's why it's really important for owners when we're talking about, like, you know, top 3 tips for, like, just knowing your cat, like really knowing your cat, knowing what their behaviors are. Because when you bring them in, we can only gather so much information from our physical exam and if we're able to do some tests, but like so much relies on owner history. How long has the problem been going on? Like what exactly is happening? Because that helps us kind of figure out higher or lower reasons for animals having an issue. Like they could be peeing outside the box because they're mad. You brought somebody in for a visit for the weekend. Like, you know, It could be behavioral, it could be true medical. You know, a lot of times if it's just behavioral, they say that the number of cats you have +1 is the number of litter boxes you should have.
Okay.
So Brianna should have 4 litter boxes. They talk about different types of litter. Like some cats are very sensitive. If you change their litter, they get upset. The litter boxes should be in quiet areas. They shouldn't be in high traffic areas next to like a washing machine. So there's so many factors that can be involved. Usually we want to rule out medical problems first, because if they have an ongoing medical issue, obviously we don't want that to happen. And then we can kind of go the behavioral route once we've ruled out anything that's a little more concerning.
Yeah.
But yeah, it is a common problem.
Yeah, that a couple of those things I did not know. That's really good to know.
And it's really hard to tell people that live in small apartments in New York City.
Yeah.
Like, oh, please have 3 litter boxes.
Yeah.
And look at you like, okay.
Yeah. But no, that's helpful. Can you talk a little bit about some common household toxins or things that might be really dangerous to cats if they eat it or interact with it?
Yeah. I think the primary thing that comes to everyone's mind is lily toxicity. So different plants have different toxicity levels. Like we think about lilies as one of the most toxic. We worry about their kidneys. And so you always want to make sure if you're having any flower arrangements ever, plants come into your household, you always want to make sure that you've gone through and everything's okay. Even if you think that it's up high, you never know when a petal's going to fall. Some things can be really damaging for them. There's a really good ASPCA plant poison website will tell you like which ones are poisonous, and it'll also tell you like the toxic principles. So lilies, we worry a lot about kidney failure, but there are some other things that, like, you know, yes, they're toxic, but they're not quite so bad. Like maybe it'll just cause stomach upset. Cats don't typically, like, they'll eat plants, but they're not typical of eating things that are, like, no offense to dogs, right? But like dogs will tend to eat things more than cats. But I mean, they can, if they get into any medications, can be really dangerous for them. Like Tylenol is very dangerous, and so you should never give animals or cats, dogs, whoever, any medications that are for humans without consulting with your vet first. If you drop a pill, like the one thing about cats is you drop something on the floor and they love to play with it. So like if you ever drop any kind of medication, make sure you can find it and pick it up, because you never know if they're going to play with it or lick it or eat it. Yeah. My manager's cat ate the toppings off of a pizza last year and got a little garlic. So that's like things that you don't know. Like food, some foods are toxic, but again, cats aren't really like getting into that territory. But you got to be careful if they're gonna like jump on your counters, because like dogs too, they're on the floor. Cats, you have to think about they're more verticals. You have to think about like vertical issues. Like, are they going to jump on the counter and get into food? Are they going to jump on a high shelf and get to your plant? Are they going to knock something over that breaks it? Then you have glass on the floor. Thread and string too. Like, you have to be careful with any sort of like needle and thread, dental floss, and like the string, balloon ties, because if they try to eat it or they swallow it, sometimes they can get caught at the base of their tongue and they get like an intestinal issue. So I guess just baby proof, and then also baby proof higher.
Yeah. What are some common symptoms of pain? You said earlier cats are really good at hiding things, maybe but like you said, once you know your cat and you're trying to figure out if they're in pain, what are some common things to look for?
I mean, I guess it depends on the kind of pain. I think we worry a lot about, like, did they injure themselves? Are they, like, limping? Are they walking really slowly? I think those are, like, the more obvious signs of pain. But I think just, like, really generally not moving a whole lot. If they're not doing behaviors that they did before, like if they don't want to jump up on something, if they don't want to jump down from somewhere, if they're, like, using a step in between. That's more, like, older cats. If we worry that they're developing a little bit of arthritis, it'll be like, okay, they used to jump from the floor to the couch, and now they're jumping from, like, the floor to, like, a little, like, footrest to the couch, and they're doing, like, a series of smaller jumps. It was a bigger jump, like doing the same step down, just not being as active. Like if they used to do a lot of, like, laser play and then they're not anymore, kind of like that might be uncomfortable for them. It's so hard to find out though, because they hide it a lot. So I guess if you ever notice that they're kind of like not really wanting to, like, extend themselves, like, you know how cats will like to do, like, little stretches if they don't stretch quite as much. But it can be tough. Cats they hide things very easily.
Great. And we had one question from one of our followers wondering specifically about cats and vomiting. You kind of just mentioned, like, dogs are more likely to, like, get into food, and like vomiting for dogs maybe isn't as alarming if you know that they ate something they shouldn't have or whatever, but maybe cats it's a little different. What would you say, like, is a one-time vomiting, at what level should you take it to the next step of coming in to the clinic?
Yeah, I mean, I feel like a lot of times when I talk to my owners, they'll say that their cats vomit. They're like, well, yeah, but cats vomit. And it's like, yeah, they do, but I mean, it also depends on, like, how often are they doing it? What exactly are they vomiting? So these are the questions I'd be asking an owner, like, how often are they vomiting? Like, what are they vomiting? And can we kind of explain it? So if they eat their food in 7 seconds, then a minute later it comes up, it's probably not concerning because they probably just ate too fast and it just, like, went in too quick, had to come out. I just want to try to slow them down. Like, if you can associate it with them eating quickly and be like, okay, it's probably just they ate too fast. If you give them something new they're not used to, sometimes it'll be like, oh, this doesn't agree with me. But if that happens repeatedly, or if they're vomiting, like, chronically, which means, like, several times a week for, like, a couple of weeks, we might want to talk about, like, do they have a food sensitivity? Do they have, like, a metabolic issue going on? Sometimes they can, like, have changes to other body organs, like kidneys or liver, that can make them vomit chronically. So unfortunately, like, that's similar to the, like, why does my cat go to the bathroom outside the box? It could be a lot of reasons. Like, why is my cat vomiting? Could be a lot of reasons. Like, benign vomiting, like ate too quickly, or sometimes if their stomach is empty for an extended period of time, they can have what's called, like, bilious vomiting. So they have, like, their biles in their stomach kind of waiting to digest something, but there's no food there yet, so they get a little nauseous and they vomit. But unfortunately, there's so many reasons, and so that's why if you have concerns and they're vomiting and you bring them to the vet, you having the history of, like, this is how long it's been going on, this is, like, how many times a week, this is what it is, because, like, is it food, is it bile, is it liquid? If there's ever blood in it, I think you should bring them to the vet. But yeah, having this background would help us kind of determine, like, higher or lower suspicions of diseases, how much we're worried, to tell you how much to be worried yourself. Right? Are you a vomiter?
He's on his back. Looking for some belly rubs.
He's like, no. I don't know if I've met many cats that like belly rubs.
Yeah, I was gonna say.
You like belly rubs, maybe?
No, not a bit. Thank you so much. This has been really enlightening to me, who's a new, I'm a dog person, but at PAWS now, I've gotten several years of cat interaction, and I am coming to love them so much. So this has been really great learning experience for me, hopefully for you all too. Any final thoughts?
No, I think at the end of the day, if you're worried, and you have your vet, just like reach out, because sometimes we can just give you a quick like don't worry about it, or other times like we can't give perfect answers. Like we might have to be like, you know what, there's so many things it could be. If you're worried, you should bring them in. But don't feel like you can't reach out to ask your vet a question. We're hopefully happy to help. Hopefully not too busy to help you guys out, just to know if you need to be worried or not.
Yeah.
Millie's not worried.
Yeah.
Just want me on the table with the treats.
Oh, sorry.
Turkey, there you
Yeah, he
go.
wants to have some snacks.
Awesome. Well, thank you so much again, Dr. Hildenbrand.
No, thanks for
Thank you to
coming.
our kitties who made a special appearance. Thank you to all watching, and thank you so much for your support.